Thank you, and I apologize for that switch in the agenda. I got so excited. But I do want Ivory Clark to come up, and she has one more question for everybody, both on webcast and in the room. So any reflections on your calls to action? We want to make sure that we capture those. We want to capture them online. We want to look at them as they come up. Ivory will read some of them for us. And so, Ivory, you can take it away from here, and then I'll adjourn the meeting around 3.
Thank you so much. So the question that we want to pose to you all as we wrap up our session today is, what do you still need to know to accelerate progress in health equity in your community, state, or at the federal level? Oh, I'm sorry. I was waiting for it to pop up on the screen.
I think a great deal of attention needs to be given to for innovation, how to fit it into a current system. Because I've been working in one area for 40-some years, and we still have not figured out how to get it into the system in a way that it's fully supported. In other words, there's health care, there's social supports, there is early childhood, and there needs to be something that is if you want to call it umbrella or whatever you want to call it, but there's nothing for supporting that agency which has the responsibility for the direct care being given. And so that's one of the things that I would like to hear.
Okay. So we do have a comment. As Helene said, how do we work better across boundaries in terms of research epistemologically? Sorry. Really? Would you? Some other responses: data flowing easily across sectors, and I need a better education about policies that impact the culture of health. Interesting. We need to collect and normalize the collection of SOGI, sexual orientation, gender identity data in research. What role can social impact bonds play in catalyzing new approaches? Any other audience questions, possibly? Or, yeah.
I would say it targets back to the point that Helene made at the end of her comments. There is this question about looking across different kinds of policies, so that those who do educational policy, thinking about what happens in public policy and what happens in social policy. And I don't think those different spheres of policy influence are conversant. And I think that will continue to be an issue across, particularly state and federal levels. I think communities are a little different. But also thinking about how each of those, how the integration of some of those policies might affect change within community settings.
And we also have what makes an effective agent for the 0 to 3 age, and how many lack that sort of steward? How many newborn has an effective? We heard a lot of ideas, but what are the next steps? How do we put these ideas in action? The low-hanging fruits. Yes.
Jennifer White, American Heart Association. I don't have an answer to that question, but I will say that another question or another need, I would say, is the specific language that is needed to translate the equity imperative in a very explicit way. There are certain, in order to achieve health equity, I think it requires us to have conversations, especially as it relates to institutional racism and you know, the barriers that have contributed to you know, communities that continue to be marginalized and oppressed. And until we have those conversations unapologetically and very explicitly, I don't think that we'll be able to really fully address these particular issues. And so I think there is a need to better translate the imperative, the equity imperative, and to make sure that we have a shared language, and we do so in a way that we can embed that in policy to make sure that there's equitable outcomes through our policy levers.
So I think from the three people who've spoken, we've heard innovation, collaboration, and conversation. Those three key items that really need to come through as we move our work forward. Not to say that there aren't others, but definitely like those three. So what are some examples of successful programs and policies that have moved the needle on health equity? Are there common elements or are they context specific? And a comment that CultureofHealth.org has community stories, issue briefs, and policy briefs available for the public, as well as RWJF's Action Framework, a useful guide to move forward. And a need would be a website or social media presence that alerts me to significant policy changes. Okay. Ruth?
If there's acceptance here for talking about out of this country, this is mainly the United States, is that right? I just wanted to mention the fact that the reason we have early childhood development in the same building with healthcare and birth and so forth is because of what I had the good luck to see in France, to see a lot of early childhood development. And then thought that that might be a very good thing to do here. So we got from the French early childhood development. Now the French have started birth centers. And so we're coming together on that whole issue. And I just wanted people to know about that because the French do have a very high rate of child and mother survival. And we don't have such a high rate. I think the French are 4th in the world, and we're like 34th or something like that in terms of. And so it's the collaboration that goes on with other systems that I was wanting to mention, which is why I asked you, is it all right to talk about something outside the United States?
Yeah, I think we're focused, I would say, US-based, but a lot of us have experience in work internationally, so you bring those experiences with you to the table. So there's always room for...
Yeah. Just one more thing I wanted to say is that the French call their system protection maternelle et infantile, protection of mothers and babies, whereas we talk about it as aid to and assistance for. And that's a very different point of view, and I don't mind copying that. I'd even go to Paris if somebody would say.
Andy?
Along the same line, just want to highlight that the UNICEF New Health Strategy for the next 15 years actually actively promotes the integration of health education and health promotion with early childhood development and disability. So that working cross-sectorially, they feel that it's really the way to address the sustainability issue.
Yes. You want to? There are a few more. We'll leave this up to continue rolling down, but I'll step away to give it over to Kimber.
Thank you, I agree.